Minister, why was an unvaccinated driver allowed anywhere near an international flight crew?
The current arrangements, Leigh, in New South Wales are that there should be every day a saliva test undertaken by anybody at all involved in the quarantine system, the port system. And so a driver should also be in that category. It would appear that he may have had the saliva test, but of course they also then promote them into having the vaccines as well. It hasn't been mandatory to date, but at any rate, we've announced today that we'll be reviewing that situation because of the current circumstances.
How come every time there's something like this, what happens is the minister responsible, regardless of the state, says, oh, yep, OK, we'll have to review it to make sure it doesn't happen again? Because these things seem really obvious, that you'd want a driver with an international flight crew vaccinated and that they would be having the daily test. It's not rocket science.
Yeah, well, thank you for that, Leigh. But the reality is that we are in a 1 in 100-year pandemic, and it's the unknown unknowns. And when it becomes an issue like this, well, we obviously have to review the whole circumstances. There has been a reluctance through National Cabinet to have mandatory testing, and I think that's been broadly understood. But it's certainly something which, as Health Minister here in New South Wales, we're now looking very closely at. So I've asked our lawyers to give us advice on that, and we'll be making some decisions shortly.
Do you reckon that the audience would buy that an unvaccinated driver picking up an infection from an international flight crew is an unknown?
Well, I just said it was. But I think the issue is
how can that
also,
be?
Well, it was. But I'll say this also. There are other factors. Nothing is ever simple in a pandemic. And the companies that actually engage these drivers, often as employees or subcontractors, have expressed concerns anyway to New South Wales Health and to police. Police actually manage these people, that they may not be able to get drivers to actually do the job if we actually force them to have the vaccine.
New South Wales has a higher appetite for risk than other states, and it doesn't resort to the blunt statewide lockdowns. However, the only way that approach can work is if the state government is on top of every tiny detail, like drivers of flight crews being vaccinated, like the fact that they're getting saliva tested every day. What assurance can you give the people of New South Wales that the system isn't rife with these sorts of sloppy practices and that it isn't just luck that this is the first incident of its kind?
I actually think in New South Wales we overall, our police, our health, our quarantine workers have done an extraordinary job, and I want to thank them for that. We've had we take the majority of people coming back from overseas. If New South Wales were not doing what we were doing, very few people would be getting back into this country, because since our quarantine system started, we've taken over 190,000 people. That's about 10 times what WA's taken. It's more than 3 times what Queensland have taken. I think our system works extremely well.
But it'll only keep working extremely well if you don't mess up these tiny details.
Oh, well, look, it's great to be expert when you're not doing the job, I guess, but our health workers and our police are doing their job, and their advice to the government has been that to date what they've been doing is appropriate, but we've now challenged that in a cooperative and reasonable way.
On the change to the AstraZeneca protocol today, what effect do you think that will have on the pace of the vaccine rollout?
I think that will send some messages, and I think we saw a bit of a drop last time in the overall vaccination rate when ATAGI made its last announcement. So yeah, I think there will be some hesitancy, but overall we have to remember that getting vaccinated in a world that is probably more dangerous than it's been at any time. Some of the variants at the moment of this particular virus are very, very dangerous, very transmissible. And we aren't going to be shutting our airports. We need to get people home. We need to have workers come home.
On your point that the world's more dangerous, more people are getting vaccinated. We know more about treatments after a year. We have good social distancing policies, hand hygiene, mask wearing in countries which mitigate against infection. Regardless of the variants, the vast majority of people still experience COVID as a mild to moderate kind of illness. Shouldn't the responsibility of a government minister not be to whip up fear by saying the world's more dangerous than it's ever been?
The responsibility of me as a minister is to make sure the community know that they should be vaccinated. They should be vaccinated. We may have the advantages of living on an island continent We may have made very good decisions, but at some point the world has to be opened up to Australia. And so the only logical position that a health minister could take is to encourage people to be vaccinated. And Leigh, that's what I'm doing.
Brad Hazzard, thanks for your time.
Pleasure.
Hi, I'm Leigh Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.